We will now move directly into session 5, COVID-19 and the environment, what's next? And this session will focus on the early lessons learned from the COVID-19 pandemic from an environmental health perspective. And before I hand it over to the facilitator for this session, Mr. Kevin Manning from the University of the West Indies, I just want to say that during this unprecedented time, before the conceptualization of the Global Youth Network Summit on Health, we were actually supposed to have this summit here at the United Nations House in Barbados. But due to everything that is happening around us, we had to switch to a virtual summit. And I must say, if not for the COVID-19 pandemic, we wouldn't have had many attendees here today. So there are positive and negatives to this pandemic, and today's summit has brought all of us together from many different countries across the world here to share our views and as it relates to climate change and the impact that it's having on persons' health. So right about now, Kevin, are you on the line?
Hi, Ashley, I'm here.
Fantastic, you can begin.
Okay. Good morning, good evening, and good afternoon, good night, ladies and gentlemen, wherever you are across the world. Welcome to the fifth and final panel of this Global Youth Health Summit on Climate Change and Health. So basically, as you would recognize, this panel is a bit longer than the rest. This one is scheduled to be about 45 minutes, and as Ashley mentioned, it would focus on COVID-19 and the environment. But basically, we'll also have an expert presentation from members of the United Framework Convention on Climate Change, the Regional Collaboration Center in Grenada, as well as Dr. Callum McPherson. So I will initially start by having these two remarks coming down. So I will start with Dr. McPherson at this stage. Dr. McPherson, are you on?
Yes, Kevin, can you hear me?
Yes, I can hear you. Go straight ahead.
Wonderful. Thank you, Kevin. And I'd like to start by thanking those of you who have put this Global Network Summit on Climate Change and Health together, the Ashley Lashley Foundation, the HAY Program, SERI, the University of the West Indies, and some of us here at St. George's University. And thank you for inviting me to say a few words about COVID. Before I do, I want to just say that here in Grenada, where I am based, I joined 27 years ago to set up a non-profit charitable foundation called WINDREF here at St. George's University. And we have today partnered with the World Health Organization Collaborating Center on Environmental and Occupational Health, the United Nations Framework Convention on Climate Change. We host one of the regional collaborating centers, and also the Global Water Partnership. Our philosophy is based on One Health, and facilitating this is the fact that we have sympatrically located veterinary, medical, public health, arts and sciences undergraduate degree and graduate programs, many of which focus on conservation and the environment. We also have a lot of student advocacy groups which are focused on climate change and the effects of the environment. And this, we've put together what we call our One Health program. And it's a way in which professionals, scientists, physicians, veterinarians, environmental experts, engineers, all share their knowledge from their particular expertise together. But we've been missing something. We've been missing the intergenerational input of the youth. And I think that we need to add, just hearing from the inspirational speakers this morning, we've got to add their voices to this discussion. So this session is focused on COVID-19. It's one of 3 global infectious disease pandemics that we have experienced over the last 100 years ago. 100 years ago, the influenza virus H1N1 killed approximately 5% of the world's population. And then 40 years ago, we had the global HIV pandemic. And that ravaged the world. Today, we have COVID-19 caused by the SARS covariant 2, which incredibly, because of our hyper-connected planet, spread to all corners of the world within a few months of its evolution in China. How this virus came to being and came to spread from human to human, where it came from, we're not quite sure. We're pretty sure it was of a bat origin. The horseshoe-nosed bats in China, in Southeast Asia, harbor a number of SARS virus strains and variants. And these bats leave their caves in the morning, in the evening, in the dusk. They fly over 1.7 million people to their feeding grounds, and then they return. And this is a fecal-orally transmitted virus amongst bats. We also use in that area the guano, the feces that's produced by these bats, for fertilizing our fields, which grow crops for people. And then there are the wet markets where bats and other animals could be in close proximity and bats are eaten. How this came about, we're not sure. Some advocate that it was of laboratory origin, and that is an argument for another day. What we do know is that the world has responded in a myriad of different ways. This virus doesn't listen to the rhetoric of politicians. You can see that the two most infected countries in the world today are those where the public health experts' opinion have not been listened to, and therefore this virus is spreading out of control. We must remember that human behavior is often the forgotten factor in disease control. One of the areas that we should, in the Caribbean, be very proud of is that of the 30 small island developing states, 20% have had no deaths from COVID-19 as of yet. We've also had a very low incidence. We locked down early, excuse me, we followed the public health advices of the experts. And this is a conundrum. We now are immunologically naive. And as we open our borders for tourism, which is the lifeblood of many of our countries economically, we're going to be having to be even more vigilant as people with this virus may come into the region. One of the big debates going on today in many parts of the world is how do we safely open up our universities, colleges, schools, kindergartens. Those that propose a very quick opening point to the fact that young children suffer less from this disease, infect others less, and it allows, if they're at school, their parents to go back to work and contribute to the economy. Those that are a little bit more cautious point to the fact that we know very little about this new virus. We don't know if you get infected, will you get infected with another strain of the virus? And like other RNA viruses such as dengue, the second infection, subsequent infections can be even worse. We know that there are syndromes that are occurring in young children. We also appreciate that we know very little about the epidemiology of this virus. It is now fully appreciated that it's transmitted through aerosolized droplets, and that the non-pharmaceutical methods of wearing masks, physical distancing, of testing, tracing, and isolating, and hand washing work very well. We know this from the evidence from so many countries that have done a fantastic job on this. I just want to mention that education is the most powerful weapon that can change the world. So said the late and great Nelson Mandela. We've got to take the best practices from those countries where the infection rates are near zero or to zero and use them as we reopen, as we evolve, because we're very new, only 6 months into this pandemic. and we're learning a lot. The research will tell us that there are some treatments. We're getting better. The death rates are falling because of better clinical management. We have clinical trials, double-blinded clinical trials on things like hydroxychloroquine, remdesivir, vitamin D, and things like ivermectin are showing great promise. The vaccine trials are now incredibly, some of them are in phase 3 trials. But we should, until those effective vaccines, if they come along, we will have to rely on the non-pharmaceutical interventions of wearing masks, physical distancing, washing our hands, and testing, tracing, and isolating infected individuals, using modern apps and data to try and prevent the spread of this infection even further. Thank you.
Okay, thank you, Dr. McPherson. You shed a lot of light on various viewpoints, echoed many sentiments which we would have heard before, but then reiterated new information which I'm sure many of us did not hear or was privy to. So that was extremely insightful. I would like at this stage to move on to remarks by Audrey Edwards, who is the technical officer at UNFCCC, the Regional Collaboration Center, based in Grenada as well. Audrey, are you on?
Sorry about that. My mic was muted. Can you hear me? Good night, good evening, good morning, good afternoon to everyone.
Great, we can hear you.
Great. As was said, my name is Nigel Edwards. I am an assistant technical officer to the St. George's Regional Collaborative Center on Climate Change to support Caribbean action as we try to improve and advance in our actions towards reducing the effects of climate change on our health. Added to what Dr. McPherson has already said, I'd just like to say, we all can appreciate that our rapid response to COVID-19 for survival depended on all our actions and also on absolute support from all governments to ensure safety and security. So similarly, governments need to have similar approaches to addressing climate change effects on health. The UNFCCC, United Nations Framework Convention on Climate Change Secretariat, has forged partnerships with regional development banks and other institutions to establish regional collaboration centers in underrepresented countries and regions. The regional collaboration centers support national climate action through capacity building, technical assistance, and strategic networking, sourcing know-how and resources to drive clean development. They were established to spread the benefits of clean development mechanism, which spurs investment in sustainable development by rewarding clean projects that reduce greenhouse gas emissions. Since the adoption of the Paris Climate Change Agreement in 2015, the regional collaborating centers have had to broaden their scope of actions, providing direct support to countries as they develop their nationally determined contributions. And to date, we can gladly report that we have 6 RCC offices globally, here in Latin America, in the Caribbean, in the Middle Eastern and African region, in Asia and Pacific regions. The Regional Collaboration Center, traffic. The RCC St. George's office here in Grenada was launched back in 2013 in partnership, as was mentioned by Dr. McPherson, with WINDRIF. And as we heard from Dr. McPherson, WINDRIF promotes health, well-being, and sustainable development through multidisciplinary research, education, and a wide array of community programs. Over the years, RCC St. George's office has worked and collaborated with many regional and global partners, such as IDB, UNEP, UNDP, OLADE, GIZ, and many others through training, workshops, consultation exercises, direct support to key stakeholders, etc., to help address the needs raised by stakeholders on mitigation efforts, adaptation actions, carbon emission reduction measures to ensure clean, safe, and healthier environments. Most recently, though, RCC St. George's launched and co-hosted the Regional Monitoring, Reporting, and Verification Hub and established the Green Climate Fund Regional Office here at St. George's University for the Caribbean region. The GCF, Green Climate Fund Office, is housed within the Department of Public Health at the university and provides technical guidance, training as needed and identified, as needs are identified by stakeholders for them to have easy access or facilitate ease of access to GCF funding opportunities. The Caribbean Cooperative Monitoring, Reporting, and Verification Hub was launched early last year, 2019, in partnership with Windrift, the Greenhouse Gas Management Institute, the UNDP, UN Environment Global Support Program. It will empower and build regional capacity for the English-speaking Caribbean countries to efficiently establish monitoring, reporting, and verification systems, develop greenhouse gas inventories, mitigation assessments, and track the progress of their nationally determined contribution for adequate reporting to the UNFCCC. The RCC St. George's office also facilitates timely communication of capacity building opportunities across the region and critical information sharing updates to all stakeholders. One such key communication that was shared was about the 8th Dialogue on Climate Action for Climate Empowerment, also known as ACE, recently launched in June 2020 by UNFCCC. The vision and activities for ACE is related to education, training, public awareness, public participation, public access to information, and international cooperation. The implementation of these 6 areas have been identified as a pivotal factor for everyone to understand and participate in solving the complex challenges presented by climate change. ACE is calling on governments to develop and implement educational and public awareness programs that will foster access to information and promote public participation in addressing climate change and its effects on our environment, ultimately on our health. In keeping with capacity building, RCC St. George's, with the Department of Public Health here at St. George's University and the WHO recently concluded an online course on climate change and health, looking at how can we define climate change and health? What are the key factors and drivers? Looking at the distribution of climate-influenced diseases, etc. There were over 800 participants from 21 countries across the globe. If you desire to have access to the resource material and videos, please send us a communication in the email and the links will be provided. RCC continues to build awareness on climate action through providing active internship programs and have received students from the University of the West Indies in Trinidad, University of Reading in England, and also from here, the St. George's University in Grenada. Interns participate in various work streams, including providing assistance to countries in the submission and at times preparation of the NDC documents. Perform policy research in energy and other relevant sectors for identifying and doing calculations regarding standardized baseline determinations, and also to generally support the RCC operational tasks. So this was just a very brief highlight of some of the activities RCC St. George's office is involved in. For more information, as I mentioned, please send us an email. We would love to hear from you at rccstgeorges@unfccc.int. Again, thank you to UNICEF, Ashley Lashley Foundation, and other partners for raising this much needed voice for accelerated action on climate change and health. We do need it, and have a blessed day. Thank you.
Okay, thank you very much, Adrian. Allow me to introduce myself. I know we are running late on time, but my name is Kevin Manning, as you would know. I am the project coordinator, University of West Indies Youth Development Program. Basically, what we at the Youth Development Program do is operate within the areas of the Sustainable Development Goals, as well as 3 other focal point areas that we recommend and know that are critical to the work of the Caribbean region. But recently, the university has undertaken a priority focus towards climate change, which is one of the main reasons that the Youth Development Program has participated and pursued so heavily this mandate. And as we go forward, you will see that the other panelists that we have on this session are extremely qualified to be sitting here. And as we move into this stage, we will begin, and I will allow the panelists to briefly introduce themselves as we go through the various rounds, but we will also engage for discussion and a question and answer coming back from you. But at this stage, I want to give you a brief message. In all of the messages, the statements that would have gone before this panel, take a look at them, the linkages and the synergies of every single one, and you will see there's an overwhelming thought or message that is coming out, and that is about youth playing a greater message, greater activism on behalf of the youth, not just in the Caribbean, not just in Latin America, but across the world. For many of you, it's nighttime, it's evening. For many of us over here as well, we are now going about our day. But at the same time, we are impacted by COVID-19. We face issues of climate change, and it's not basically looking forward to much hope for many people I have discussions with. So you will see in many of the discussions that we have in this next round, you will see also the messages that echo the ones from before, but also new messages. And we look forward to seeing how best you'd engage with us, how you engage with our panelists, and basically how best you have more of an impactful discussion here going forward. So now, how do we begin? Let's begin with our first panelist, Shirley Simon. She is UWISTAT Ambassador for Climate Change and Disaster Risk Management. Shirley, are you on? Hi, Shirley. So I have one question to you initially. Do you think the climate change efforts have been significantly hampered by the rise and subsequent spread of the novel coronavirus? And if you think so, why? Shirley, we're having a bit, I'm not sure if it's just me, but we're having a bit of a challenge hearing you.
Yes, we're having.
Shirley? Yeah.
She seems to be having a bit of technical difficulties.
Yeah. I'm not sure if she's hearing me.
Do you wish to move on to the next person until she rectifies that problem?
I would ask you guys over there to work with Charlene as we move on with this next one. Tanya, I know you are online. Charlene, we will revert back to you. But Tanya, your question. Right, so Tanya, your question. You are from the US, but you have been in Caribbean for some time. As a graduate in the Masters of Public Health, what is one health example that the Caribbean got right, and one you think we could learn from the US in the fight against COVID-19?
I think the Caribbean, specifically Grenada, made the commendable strategic move of establishing curfews and bans on international travel early on in the fight against coronavirus. This restriction of movement helped stop the spread of the virus throughout communities and prevented the Grenadian healthcare system from being overwhelmed. The United States, on the other hand, was very slow to shut down schools and workplaces, which allowed the virus to spread undetected and ultimately cost us 132,000 lives throughout the country, with 32,000 lives lost in just New York alone. However, the United States quickly mobilized resources to ensure that there was no shortage of ventilators throughout the country. In addition, when there were worries of a lack of hospital beds in New York City, hospital ships were dispatched and convention centers were converted into medical facilities. This helped ultimately avoid the medical triage crisis, which had occurred in Italy. Lastly, the United States has been at the forefront in terms of developing a vaccine for COVID-19, currently conducting clinical trials, and in the long run, paving the way for countries to open back up in the near future.
Okay, wow, great. Didn't know that there was so many ways in which we could incorporate different stuff. But I want to move on to Arabelle. Your first question. What is one key environmental action that you believe the countries of the Caribbean should implement as a priority?
Hello, everyone. My name is Arabelle James Anglese. I'm the National Coordinator of the Caribbean Youth Environment Network in Barbados. And one key environmental action would be to educate our citizens of the Caribbean. An educational movement where the focus must be on scientific literacy through formal, non-formal, and informal education, by making the environment a cool topic and important. By educating oneself, proper action can be taken and the right policies can be implemented. Many people often hear about climate change and its impact, but the average person does not truly understand what it means and how it can affect and is affecting their everyday life. So the environmental educational movement should not solely be in the Caribbean, but also the rest of the world.
Okay, very interesting. I want to touch base with Charlene for a moment to see if that communication problem has been rectified. Charlene, can you just try one sentence for me?
Can I hear you now?
I'm having a bit of a challenge still. Try again.
Are you hearing me clearly?
Okay, it's still having much of a challenge. So I want to check back with you a bit later. I recognize I'm having still much a press for time coming at me. So I want to move on once again to Tanya. Tanya, you are an PhD student graduate from St. George's University. I want your opinion on this, and your insight on the previous question was very, very interesting. But when this crisis is over, this COVID-19 crisis, many experts believe that we need to quickly readjust to catch up on the time lost in relation to climate change. In your opinion, what areas must we address first? Is this like fossil fuels, health, education, environment, or something that I'm not seeing? Could you help me here?
Yes. So the COVID-19 crisis has put the entire world on pause. And with that, much time to reflect on how we can adjust, not only to a new normal, but a better normal. In New York City, where coronavirus was especially deadly, the pandemic opened our eyes to environmental justice issues. Studies found that low-income neighborhoods with more environmental health hazards such as poor air quality, were disproportionately impacted and had a higher concentration of COVID cases. In fact, according to Harvard researchers, every additional microgram of particulate matter, 2.5 per cubic meter, is associated with a 15% increase in death rate from COVID-19. Air quality is impacted by things like waste incineration, and almost all waste incinerators in New York City are located within 3 miles of colored, low-income communities. To make matters worse, the COVID-19 crisis resulted in a 40% increase in household waste, further impacting these vulnerable communities. Therefore, in my opinion, the environment is an area that must be addressed first, as it affects the health of communities.
Wow, interesting. Ladies and gentlemen, I want to go back to something because I know we are pressed for time and we had a bit of technical challenge, but I want to ask you to do something for me. I want you to, when you get the chance, to go back and read the biographies of everyone on this panel. You would see why they are so qualified to sit here. Many of them don't get the chance to truly introduce themselves. As you will see, they are experts in their area. I call them amazing people, in my opinion, because they are constantly educating me on the challenges, the ways forward, and how best we can continue to do stuff. As you would have heard, Arabella is National Coordinator for CYEN in Barbados. Tanya is an MPH graduate out of St. George's University. And I was mentioned, Shirlene is the Vice President for UWSTAT for Disaster Risk Management and Climate Change. So go back, read those bios, and see where we can truly go. We're trying to wrap this session for 12:30. So at this stage, I want to incorporate some questions or ask you to pose any questions you have into the chat so that our Hey Ambassador Jamie Lee can bring them this way and we can put them to our amazing panelists. I think we also have one question for Dr. McPherson already. So I want to come back to that, but I want to go back to Arabelle first for her second question as we continue this discussion. So Arabelle, climate change and environmental degradation has begun to produce extreme climate events such as drought or stronger, more frequent hurricanes that we will witness severe climate displacement. As a young person, how confident are you in your government or international agencies to be able to address these issues effectively?
Thank you, Kevin. In the Caribbean region, our governments have taken an adapt and improve approach, because even though the Caribbean's contribution to greenhouse gas emissions is less than 1%, as a Caribbean community, year after year, we bear the brunt of increase of storms and hurricanes. So for example, in Barbados, we have the Richard Haynes Boardwalk, which acts as a seawall. And this is a barrier between storm surge and land. So being that our governments have already taken steps to effectively address these issues, I am confident that they will continue to do so as these issues arise. Thank you.
Okay, thank you. Okay, so I want to go. Dr. McPherson, are you on?
Yes, I'm here, Kevin.
Okay, so we have one question coming to you. Has the COVID-19 pandemic done more good than bad for the environment?
Excellent question, Kevin. I did read in the literature that was sent out by this organizing summit. There was a Lancet paper commissioned with UNICEF, and it stated that the carbon reduction for this year with all the lockdowns has been approximately 5%. I think it's also done some other significant things. People are learning to work from home. People are learning that they can commute the 3 miles to their office by bicycle, through walking. I know in the UK, they're putting in many more cycle paths. People are looking at electric vehicles, electric scooters. And so it has given us a pause. It's given the planet a very welcome pause from all the commuting, the flights that everyone was taking. And that has been to the benefit of the environment. How long that will be sustainable is questionable, but that is a challenge for all of us. So I hope that we will all learn to do a little bit more to be environmental in our workspace. Do we have to travel into work every day? Sometimes, some people will have to. Others, we might be able to walk in, cycle in or work from home.
Okay, there you get it. We have to make some changes, but we also have to see exactly what we can do. I want to check with Sherlyn.
Yes.
They said that there's some ways in which she may have adjusted her audio. So Sherlyn, are you there?
Yes, I am. Are you hearing me clearly now?
I'm hearing you, but there's still some challenges in terms of the clarity of the transmission. I'm not sure what is the challenge. Okay, yeah, we're gonna have to move on. I really wanted to get your input at this stage, but we're gonna have to see if we can revert to you once again. But Tanya, once again to you. Just checking in questions, right? And I saw one coming in for Tanya. Right, so Tanya, is now a good time to capitalize on the impacts of COVID-19 to determine just how best we can make a difference? And why?
Thanks, Kevin. So now is the perfect time to capitalize on the impacts of COVID-19 because we are resetting our normal or our new reality. And if we as activists can have climate action at the forefront, I'm sure that we can make a huge difference. There is a major risk that as we try to revamp the economy in a post-COVID-19 world, that we forget about our long-term goals and settle for short-term fixes, which would have dire consequences on the environment. The global nature of COVID-19 has shown us that we as a globe can indeed come together to help one another and also understand our interconnectedness, that what we do in one part of the world can impact other parts of the world. There is so much strength in numbers, and the large-scale response to the coronavirus has really highlighted the power of being united against one cause. We can now translate this mindset and take this momentum into tackling climate change together. Additionally, we have seen that the fight against coronavirus, for example, wearing masks or self-isolation, did not require new technology, but instead a new way of thinking or a change in culture. And I think a similar response is needed for the climate change crisis, in which we will ourselves to change our lifestyles for the better of the planet. Scientists are constantly reminding us that we have very little time left to avoid the worst consequences of climate change. So I do believe that we need to seize this opportunity to rebuild our society the way we envision our future to be. Thank you.
Okay. Hopefully the new technologies can offer a lot of true changes. We can really see some ways in which we can combat COVID-19 and climate change at the same time. And there's just a lot of thoughts going through my head. But I want to move to Arabelle's third question in this discussion. Arabelle, COVID-19 has created a new normal. I know many of us don't like that word, but it's true. So in relation to our daily lives, and has witnessed an increase in government spending in areas such as healthcare, social protection, and less revenues for government. So in your opinion, which do you believe is a greater threat, COVID-19 or climate change? And why do you think so?
Yes, Kevin, we all understand that COVID-19 is an immediate threat as it is current and ongoing, and hundreds of thousands of people are dying. However, climate change has been around for many years and is still here despite the challenges COVID-19 presents. So with climate change, the likelihood of more pandemics is possible. Long-term, climate change will have greater impact and has already had a significant impact over the last 10 years, where lives were lost, and the potential for more lives being lost is even greater. So for example, the lives lost in Puerto Rico by Hurricane Maria in 2017 and Bahamas by Hurricane Dorian in 2019. And these countries, there are still people unaccounted for. And honestly, Kevin, that is truly heartbreaking.
Absolutely, just challenging. Sherlyn, I hope you're still online. I want to try you again, but without the video. Let's see if that works. I'm really trying.
I'm here, Kevin. I'm here. Are you hearing me now?
Okay, I can hear you, yes. So I want to have one question to you. How are youth ensured that they are heard when it comes to climate change?
The youth of today are very innovative, right? As Holland says, young people are more connected with each other and this planet than any other point in humanity's existence, right? For those in authority, policy makers, if they listen to the voices of the youth, what they have to say, things will go better. If they are included in policy making, everything will be better. I say if you teach the youth how to fish, they will have food all the time. But if you carry them to fish and don't teach them how to, they will not know. Each one can teach one. The older ones who are in position and who are in authority need to take hold of the younger one's hand and guide them. Teach them about climate change. Teach them about the environment, and they will ensure sustainability in 2050. Thank you, Kevin.
Okay, strong words coming from you right there from Trinidad and Tobago. I love the discussion that is going on, but I know we are out of time. So I want to have one final question, and I think I'm going to aim this at Tanya. Tanya, what is one message that persons listening to you across the world should take away from this panel or this discussion in your view?
Thanks, Kevin. So the one message that I would like to pass on to viewers is that climate change is already here. It was here and it will continue to impact our lives in even more severe ways unless we make major changes. Your health, your livelihood, and your world is at risk. The COVID-19 crisis has made it clear that climate change is not a problem that we can just shove under the rug. It impacts our health, especially in vulnerable communities. This unfortunate crisis, however, presents to us a unique opportunity to set the tone for the years to come. So, as the youth of today, we need to ensure that key decisions are made with our future in mind. Thank you.
Okay, thank you. And that is it for this panel, ladies and gentlemen. On behalf of myself, and representing University of West Indies, on behalf of the panelists, and behalf of everyone else who's worked behind the scenes on facilitating and moderating this panel, I do want to extend significant thanks to UNICEF for Eastern Caribbean Ashley Lashley Foundation for being able to provide this platform so that young people across the Caribbean and the world are able to voice their decisions, voices, considerations, everything going forward in relation to this summit. We have a lot of work to do, and we look forward to what we can do best, and maybe we'll see what can happen for COP26. Ashley, over to you.